Hi everyone, and welcome to this short video. My name's Ruth Stross. I'm a neurology nurse by background. I also sit on the RCN Neuroscience Forum as a committee member, and I'm a trustee with MS Together. I'm here with Emma Edwards, who is a mental health nurse by background. She's now working as a Parkinson's nurse specialist, and she also has experience as a suicide awareness trainer. For Mental Health kind of Awareness Day, for this year, we thought we would focus on the importance of supporting people with long-term neurological conditions, which is very much the background that both Emma and I come from, such as Parkinson's, MS, and others, where the overlap with mental health is often overlooked and unsupported. This year's themes include workplace mental health, the importance of community, and ensuring access to all services, all of which resonate strongly in neurology practice. Together, we thought we could explore some of the challenges that patients face in accessing mental health support, the impact this has on their care, and how we as healthcare professionals can look after our own well-being while supporting others, which I think we often don't really allow ourselves time to do. So I guess to start with, I thought it would be really helpful to ask Emma, kind of a little bit about your background, because it's fascinating where you've moved from mental health into neurology, and then, as I've mentioned before, you've worked also as a suicide awareness trainer, and why you feel it's so important to talk about this area.
Thank you, Ruth. So I started my career as a nursing assistant. Actually, I was going to be a drama teacher, Ruth. So my mum said, if you're gonna take a year off, you need to work for that. So I was put into the local mental health hospital to work for a year, and I just never left. And I'm also the product of two psychiatric nurses, so it was sort of inevitable perhaps I would land into this as a career. And I absolutely loved it. Worked in dementia care, but sort of more latterly in psychiatric intensive care, which was, the old locked wards. But I absolutely enjoyed the pace of that. And then in 2009, I was sort of looking at, what should I do? Is there something else that I can do? And we had in the place that I was working, we had a chap with Parkinson's, and I met his Parkinson's nurse who came in to review him. And she said, look, I'm leaving actually in about 6 months' time. She said, I think you would make a great Parkinson's nurse. And I thought, I don't know anything about this. But she said, just go for it, just see what you think. So I did apply for it, and I was successful in getting it. So that was 2010. And it's just kind of rolled from there, really. There's about I think the last count was there was about 515 Parkinson's nurses in the UK. But I think from that, there's maybe 3 or 4 that are mental health background. But I found having that background so advantageous with looking after my patients, and we'll go into that a bit more. But in 2019, unfortunately, one of my patients took his life, which was a great shock to me. And I wanted to find out more about why this happened and was it common, and there really wasn't a great deal of information out there. So around that time, about 6 months later, a job came up for a secondment looking at suicide awareness trainers for our local organisation, and I thought this would be a really great opportunity to find more out about suicide and how it can affect people, especially with neurological conditions. So I did that for a couple of years, and then brought that knowledge back into my post that I do now, and have kind of shared that information with anyone I can corner, Ruth, or anyone that's interested. So
it's absolutely fascinating, and it's interesting because I think where my kind of interest came from, I came probably from the opposite, where I was a neurology background, having looked after patients with MS and other conditions. I just realised, I think, as I had worked in the area and listening to patients in clinic, that there were so many people with mood disorders, and then I went off to look into that a little bit more, who weren't necessarily having kind of initial assessment to decide what was the problem or what was going on and what needed support. But also with, particularly with multiple sclerosis, where there is some cognitive impairment, I struggled in clinic, or I struggled when I saw people on the ward to know which it was. And
Mm.
I think because we don't do that initial baseline assessment, and so then I went off and decided I wanted to look into it a little bit more, um, and I guess that brings me to, what do you think are, it, it's quite tricky, isn't it, when we look after people, we can see the kind of the difficulties that they're struggling with. So what do you think are the common challenges for people with neurological conditions?
So in Parkinson's, but again, from the research I've done, it's pretty much across the board, is low mood and depression, anxiety is massive. And I mean, what we talk about neurological conditions, these are themes that are really common and higher than the general population across the board in long-term conditions. So I just don't think it is neurological conditions. However, anxiety, depression, cognitive issues, as you've highlighted, even psychosis, to be honest, in relation to the nature of the condition and sometimes the side effects of the medications that we put people on. Yeah.
Yeah, no, absolutely. And it's interesting. I know we've talked before about the fact that I work with MS Together, which is supporting young adults with a diagnosis of MS, and you work with young onset Parkinson's disease.
Yeah.
But a lot of the evidence seems to be around that actually the kind of psychological impact at diagnosis is higher
Mhm.
in young people. I don't know if you want to, I don't know what your thoughts are around that and the services that are available.
No, I mean, when I've done a little bit of research into sort of suicide and neurological conditions, um, something that again across the board is that suicide is often higher in that first year after diagnosis, and then the actual risk of it lowers quite dramatically afterwards. So I think there's something there about the shock of diagnosis and perhaps the support that is offered to people. Um, but I think, yeah, there's been lots of publications in the Parkinson's world about how devastating and how much of an impact delivering the diagnosis of Parkinson's can be, and the experience thereafter. So those that had a very sensitive delivery of the condition, and but balanced with hope, seem to do much better with their mental health than those that were given very little information about their condition and how to best self-manage and what is out there to support them. And you know, and they very much dipped soon after with their mental health. So I think there's something about setting the scene in a really proactive and supportive way with the diagnosis, because we know the evidence is there to support that it can dive pretty quickly.
What have you found with the young onset Parkinson's that helps with that diagnosis? So I absolutely hear you on how the diagnosis is given, and that first year. What
Mm.
do you think that there is, I guess, the charity that you work with and likewise
Mhm.
are hopefully helping to support people, but what do you find patients come in and say is actually helpful in that first year?
So yeah, thanks for highlighting the charity. Actually, Spotlight YOPD. I think it comes down, and the feedback certainly we get from our members is that social connection. So often, well, we know that there are lower numbers of people being diagnosed with Parkinson's under the age of 50. And often professionals, you know, especially those GPs perhaps that work with them to start with, or identify those signs and then signpost them on, they'll often say, you know, this is quite a rare condition, and in its way it is. But then that those sorts of statements can very much isolate people and make them feel very alone. So certainly our community find great strength, I think, in each other. Um, and certainly one of our trustees, Andy Hobbs, who's absolutely wonderful, and is often will talk about the powers of sport in a way of everyone coming together and literally kind of like being in the same boat with each other. So I think social connection, most certainly. But again, it's that early signposting to these areas where they can get support. I think that's so valuable.
Yeah, I agree. One of the things interesting that I've really learnt from working with Amy Thompson, who's the CEO and founder of
Mm,
MS Together, is that the whole conversation has changed. Historically, I know we used to signpost people away from Google because of the frightening
mm,
things that could come out from a Google search. But actually, it's interesting because I think young people are young adults are very much using social media as a way of connecting. And one of the things we've been doing sort of workplace talks, and it's really interesting because they are, to a certain extent, expecting a kind of a response from those around them. More
mm,
so, I think they're taking, I don't know if it's about taking ownership. I wouldn't like to speak for them, but they're very much expecting certain things, rather than, I think, historically, where the patients I spoke to would often feel like they were apologetic, or, in the workplace, they
mm.
felt that it would suddenly just affect how they would, how they were perceived, etc. And I think one of the things that Amy's been doing a lot of is they've got like these regional road shows, they have
Yeah.
local support networks, they go to the pub, they have a kind of a mentor support kind of buddy program, and they have got a little bit of counselling that's being funded. So I think it's interesting because that's being driven by the charity. So
Mm,
it's being funded. So there is obviously a need for it. And I think that one of the, we talk about the barriers to accessing some of these mental health services. I know, again, historically in my area, that a lot of the services were not targeted to people with a long-term neurological condition. They were very
yeah.
much around a divorce or a loss in the family or something that was an acute issue, not a long-term neurological condition. I think people really need to be aware that when they're referring patients, it's really key to look at what you're referring them into, because if it's not relevant, they often disengage, and it's not helpful. So we need to be looking at services that are really targeted to that kind of support rather than, I think, what exists.
And I think that's the onus is on on the healthcare professionals knowing what is out there, isn't there? And we often say about working with the voluntary and charity sector, but you've got to know what is out there and what would be useful for the people that you're working with. And again, age will come down to where you might sort of signpost them into. But I think you're right as well, and you touched upon that early education about their condition, which I think again is so valuable. And I think traditionally, when I started work as a Parkinson's nurse, that that knowledge about Parkinson's was very much kept by the professional and given sporadically throughout the condition. Whereas now, I think, like you say, with the rise of social media and people connecting with each other, that need for good quality evidence and information is there right at the beginning and throughout the rest of the condition. And I think charities, especially Parkinson's UK, is we work really in tandem with them, and they're really up to speed with how the NHS works as well. So when you can have these really good relationships with the voluntary and charities, I think it's really helpful for the patient as well and their families. And I think that's important to note, is that, and we're obviously talking about mental health, is that it's not just the person with the neurological condition that gets affected, is it? It's the family around them. It's this, often it can be a bomb, feels like a bomb going off, but certainly there's that ripple effect, isn't there, on 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 mental health in families. So it's about recognizing that as well. And sometimes when you can educate everybody all together, so these groups where, certainly in Parkinson's, we have newly diagnosed group, we ask the families to come in so that we can kind of support them and signpost off so they're aware of things to look out for.
Yeah, no, I agree, and you're absolutely right. I think that unpaid, the family and potentially unpaid carers, there's
Yeah.
massive evidence around the mental health effect on them. One of the groups that I've been working with is a company called Mobilise.
Mm-hmm.
James Townsend, who is a carer for his mother with MS, and
Mm.
Suzanne Bourne, her partner or her husband, has Parkinson's. So they've set up this absolutely amazing company, and they provide huge amounts of support. So I would say, if you're watching this, please have a look at what they do.
Mm.
I mean, do you think, other than the kind of, as you say, it's very much about working with the voluntary sector, and I think that is part of this NHS transformation plan, is how we can streamline services so they're not duplicated. Do you think for the moment, what would you advise a person, who is concerned about a patient they're looking after within
Mm.
the NHS? What would your recommendation be?
So again, I think we're guilty of working in our silos, and maybe just passing everything back to the GP. So certainly when I do my training about mental health awareness and suicide awareness in neurology, is to know what is out there, know where your front door for mental health services is. So recently, it was changed so that if you so a lot of organizations had their own mental health helpline, which was like a crisis helpline that staff could ring if they were worried about their patient, but also patients and their families could phone. But they've streamlined that now to it being the 111 number. So 111 option 2 has been an absolute game changer in terms of a really easy thing for staff to remember, but also really easy for patients as well to access. And a lot of these local organisational helplines, you can go through that 111 number and ask for advice, like really immediate advice. But they also often have like a backdoor number for your for staff. So again, I would recommend that staff find out where they're or what the number is for that, if there is one there. Because often there is this, and that's been a criticism, I think, of mental health services for a long time, is difficult to navigate to know who to phone. But most places now have streamlined it, so it's one number that you can phone, and then they kind of I'm just trying to think of the word, not gatekeep in a kind of word, other services. So you don't necessarily have to know every mental health service that is out there. You just need to know where that front door is to be able to access them and get a little bit of advice. So, even though I've been a mental health nurse really for nearly 30 years now, I will still ring up and say, look, I'm really worried about this patient. What do you advise that I do next? Which service should I be looking at referring to? And they're often more than happy to either say, well, actually, we'll take up the mantle here, or you need to go this, you need to phone these next.
That's amazing. Well, how do you access that? Is that through the phone 111 or
So
is that online?
111, option 2. So option 1 is physical health. Option 2 is mental health. And wherever you ring, and I've tried this. So I tried this the other day when I was up country somewhere and not down here in Plymouth, and it on my mobile phone, and it took me to the area that I was in. So some
That's
clever,
amazing.
thing will
Yeah.
pick up the area that you're in.
Okay. I think that, yeah, that's really key, isn't it? That's a really important point from this. What do you think are the kind of on the back of that? What do you think are the role of healthcare professionals working in neurology teams to support patients?
I think we need to upskill. I don't think I think we all feel that holistic assessments in neurology is the way to go and that we all strive to do that. But I think perhaps there is a little bit of a worry that we're going to say the wrong thing, especially when it comes to assessing for mental health issues. So again, it's not a new term, but this parity of esteem is about considering mental health as important as physical health. And to do that, you need a bit of confidence to ask the questions. And confidence, again, comes from often being educated in it. So it's about upskilling ourselves into having the confidence to ask questions about mental health. But as we've just been speaking about, Ruth, that ability to know what to do with the answer. And often it's not just us holding, that someone has divulged that they're very depressed or they're thinking about taking their life or they're too anxious to leave the house. It's doing something with that answer. And what we also know is the more information that mental health and psychology services have, the richer the referral and the more accurate that support is going to be. So again, I think it's having that confidence to ask the questions, the knowledge of what to do with the answer. And I think it's reassuring the patient that with the right help, do you know what, you can navigate this, that people do come out the other side. So giving them hope that yes, they may be struggling right now, but with the right help and the right medication, do you know what, they can get through this.
I think one of the things that I've always been worried about, I definitely speak for myself on this, is that sometimes if you feel like that you don't have the knowledge and expertise to ask the questions, people are concerned that if someone is suicidal, they're going to make the situation worse. What does the evidence say? What
So
do you think on
there's
this?
no evidence to say that by asking the question, you know, have you had thoughts about taking your life, makes anything worse. In
Mm.
fact, the research backs up that this could be a potential life-saving question. So often when I ask that question, the most common response is actually, no, I don't feel like that, Emma, or yes, I did, but I don't feel like that now. Um, but when someone has come back and said, actually, I do feel like that, even having that conversation and digging in a little bit deeper is such a therapeutic thing to do, that often by the end of that conversation, they're not in such a bad place. So just even, like I said, so even just having that conversation can be therapeutic in itself. But again, it's drawing out the information so that you have the richer referral to signpost on.
Yeah, absolutely. I think people are always concerned about not having enough time and things like that, but just starting that conversation, at least then you have something to pass on, and the support is there. So yeah, and I know you mentioned earlier that you'd spoken on a Neurology Academy webinar on suicide awareness, so that's
Oh.
online. So if
That
anybody
is
wants to know,
online. I think if you just it's on the Neurology Academy website. But even if you just Google Neurology Academy suicide awareness, it will take you to the YouTube video, and that's where certainly I share my experience of assessing for someone for suicidal ideation and what to do with the answer. So you can very much kind of have a look there. And also, I still teach about it now, actually. There still seems to be an appetite within neurology teams to, to better understand this and upskill their staff. So I'm here for it, Ruth. Just put it out there. I'm
yeah.
here for it still.
Yeah, absolutely. And there are other links which we will add in, which I have
Yeah,
to say. I
definitely.
mean, one of just sort of towards the end of this, one of the things that I don't think we're very good as healthcare professionals. We're good at sometimes looking after others. We're not good at looking after ourselves. I know that Charlie Peel worked really hard on a health and wellbeing series, which is out there for everybody. It's bite-sized
Yeah.
information about supporting yourself. And you know, we talk about compassion fatigue and burnout and all of these things. What
Mm.
from kind of what do you think we can do to support each other?
Oh, interesting. So we know it's an issue. The Royal College of Nursing did a bit of a deep dive into their members and mental health last year, and they found to their helplines there was about a 54% increase in nursing staff saying that they had suicidal thoughts. And they were saying, I think it was nearly 70% were saying that they attributed that poor mental health to workplace stresses. So yeah, it's definitely something that is something that I'm very conscious of, and I've suffered with sort of poor mental health around work many years ago, so it's very relevant for me as well. Um, so I think we do know that healthcare professionals perhaps have this higher risk of experiencing stress, but I think we're terrible. I think we're terrible at acknowledging that and doing something for it until we are at breaking point. So I think we talk about, has there been a cultural shift with nurses and doctors and other professionals being more open with it? And I don't think we are. I don't think we're there yet. Um, but I think it's something that we can change if we just make it a bit more sort of acceptable to talk about. You know, that we are maybe struggling
Yeah,
at
yeah,
times.
I absolutely would agree with you. And I mean, I think probably many people that are listening would agree that at some point they've struggled themselves. I think
Mm,
for me, these talks that I've been doing in the workplace, it's really helped me think about what my kind of sport. But I think part of the conversation is around the visible and invisible symptoms, and visible ones often you can seek support for and people feel
Mm.
able to ask the questions, but when it's invisible you don't particularly uh, you, you don't particularly do so, because I think it's a case of, well, we just get on, people can't really see this. And I know that's partly because of the way that people have had responses, so they may well have, you know, reached out and not had as favorable, or as not, you know, not had the support that they would like. So I know we were talking about the kind of the themes around the World Mental Health Day for this year. I don't know if you want to comment on it, or what you think are the key priorities within that for us.
I think it's not rocket science, is it? It's not anything particularly new, but it's about, and I think as well, like with the rise of hybrid working, we're working even more so in our silos, aren't we? So as with what we would recommend to our patients about social connection, I think there's something there about being connected with others, you know, and in theory, whereas we're best connected than we've ever been with social media, with, you know, with Teams and Zooms, and but I still think we struggle. So I think it's about those regular, you know, check-ins with your teams that you're okay, not just with, you know, how you're managing caseloads, but generally and authentically asking if people are okay, and also giving people that space and confidence to say that they're not okay. And again, it's knowing what to do with the answer with that. Is it, if it's a colleague and you're a peer, is it just saying, well, we'll need to kind of have a chat with our manager about it, but I'll come with you with it to talk about this if you don't want to do it, or knowing what is out there in terms of like occupational health, and there are avenues for support there. But something that I've certainly found after my little mental health blip is finding the right tribe, and we've spoken about this before, Ruth. And it may not be those people in your immediate workplace, but there will be something out there for you. And I think I found that in the work with Neurology Academy, and with my work with Spotlight YOPD, that you find kind of like-minded individuals and friends, and so it's looking at what is available locally, but also nationally out there as well.
Yeah, no, I agree. And I know you mentioned around the information around the new study looking at sort of nurse
Oh
suicide.
yeah, there's a great study that have is come out, and we'll add it to maybe, you know, when we put this online, we'll put a link to it. So we know that nurses unfortunately carry, I think it's about a 23% rate higher than the general population of dying by suicide. We don't quite know why. We know it's female nurses predominantly, middle-aged nurses as well, which kind of goes in with the you know, similar patterns with the national look at. But it's something that we need to find out more information, because I think that's the key then to supporting our nurses better. So it's a national suicide nursing study, and they're looking for people that have gone through this. These have had these feelings, but also like their control group as well. So I'd really urge you to kind of have a look at that research study. Um, yeah, yeah.
Yeah, yeah, and I think we'll also put some information around other healthcare professionals, because I do know that there is a higher rate with others.
Doctors. I mean, the Laura Hyde Foundation are excellent at supporting blue light workers across the board. So not just sort of healthcare professionals, but people that work for the police force and the fire brigade. And they're absolutely wonderful in supporting and signposting onto different services, because again, they recognise that people that work and support others are rubbish at supporting ourselves. So there needs to be, you know, something for us out there as well.
Yeah, and actually the third main theme that seems to come
Mm,
through from World Mental Health Day this year is around
mm,
culture and access,
mm,
and it's an interesting conversation, which I know just sort of talking around how different communities view mental health and seek help. I know there's a
Mm.
massive variation, but you were mentioning about the kind of latest research.
I I found it so fascinating. So what we do know, again, from the data, is that there are certain areas in the country that for many years have had a high suicide rate, and it often links in with higher rates of deprivation. So the northeast and the northwest of England have been high, as has sort of Cornwall and areas in the southwest. But London has been, it was one of the highest many years ago, but for several years has been the lowest in the country, which really surprised me, and I never quite knew why. Um, but there was another study that came out just a couple of weeks ago that looked at populations and how ethnically diverse these populations were. And it showed that those that had the higher rates of ethnic diversity had the lower rates of suicide. So I think there's something in there about the cultural richness, perhaps, of support that we can give each other, or maybe that exist in those communities that we could learn from.
Yeah, absolutely. It'd be good to put that link in because it sounds like it's a study that we could learn a lot from. Yeah. Just kind of, I guess, in closing, thank you very much for doing this, Emma. What do you think are, I don't know if I'm top tips, what would you say are the kind of key points for healthcare professionals to be able to look after themselves and others?
Okay. So after, I don't know, 31, 32 years in healthcare, it comes from very much a personal point of view, but also backed up by the research, Ruth, I will say. So I've mentioned it throughout. We are hardwired for connection as human beings. So social connection is key. We do not thrive in isolation, and that's personally and professionally. So don't put yourself in a place where you are isolated. Try your best to find your tribe and to link in with others. I think something that I've learned the hard way is having professional boundaries in place, and trying, for example, trying your best to leave work on time every day. And it is difficult, but I've I've worked 13-hour shifts and have not finished or felt that I'd finished for the day. I've worked 7-hour shifts and had that same feeling. So I don't think it ever really helped my mental health and that feeling like I was on top of things. So I think having those professional boundaries in place and learning to say no. Um, but I think most of all is that, if you had crushing chest pain, I'm pretty confident that you would not be too embarrassed to ask for help. And I think when you're having very negative, dark thoughts, I think staff or people need to feel that that's their metaphorical crushing chest pain there, and that they need to ask for help, and that there isn't any shame in asking for help. Um, but I think those are my top threes. I mean, I could go on and bang on about this for weeks, Ruth, but they're my top threes after you've pinned me down for them.
No, absolutely. And I really appreciate it. Thank you, Emma. And thank you everyone for listening to this. I guess for me, I just reiterate what you said. It's just about looking after ourselves. It's about making that small connection. It's just about asking others. And yeah, just really looking after ourselves and those around us. So thank you, everyone.
Thank you.